Every vascular surgeon knows that moment when the no-option patient looks at them waiting for hope that can't be given. It's gut-wrenching because despite decades spent perfecting revascularization, some patients reach the end of what surgery, stents, and bypass offer. However, there's a frontier emerging that is focused on something very different. Not how we bypass disease, but how the body may regenerate blood flow where surgery cannot. My name is Mink, and after years of studying vascular disease, I believe our research deserves every vascular surgeon's attention. Let's start with the patients we're really talking about. No-option patients with chronic limb-threatening ischemia facing amputation, no bypass targets, and no remaining stent options. We all know what that means. Amputation, high morbidity, high mortality, and a devastating quality of life. Our research focuses specifically on patients who have exhausted the standard treatments. That includes chronic limb-threatening ischemia, ischemic cardiomyopathy, dilated cardiomyopathy, and angina. Obviously, these are different disease states, generate similar problems. The vascular system has failed, and traditional tools are no longer sufficient. The question becomes, what if a solution isn't another device, but this patient's own biology? What we've demonstrated across 498 patients to date is a very interesting outcome. That is that the body can regenerate circulation where the body signals that need using an autologous stem cell. In our phase 2 CLI study, researchers tracked changes in wound care. Average wound size decreased from 146 millimeters squared to 0.46 millimeters squared. In our controlled phase 2, investigators compared outcomes between study groups to understand how an autologous cell approach might influence vascular repair. The University of Toronto delivered to the 41st meeting of vascular surgeons that 83% of the patients they followed for 4.5 years experienced healing of ulcers, cessation of pain, and no amputation. In cardiac research, we're studying whether regenerative medicine may influence heart function in patients with ischemic and dilated cardiomyopathy. We published 3 studies of ischemic and non-ischemic dilated cardiomyopathy treatment and demonstrated up to a 27% improvement in left ventricle ejection fraction. So what is ACP exactly? Angiogenic cell precursors are a cell population generated from peripheral blood. On day 0, we draw a patient's blood. These cells are cultured for 5 days, and on day 6, go through a quality control check. On day 7, are in the physician's hands. The physician and patient are in a preset appointment, and the physician injects the cells into the limb if treating peripheral arterial disease, into the heart if treating heart disease, or into the spinal fluid if treating vascular dementia. I'd like to invite vascular surgeons to speak with our research team. Please book a short call using the link below. We will put you in touch with a subject matter expert so that you are physician to physician, understanding the therapeutic mechanism of action and our clinically relevant, statistically significant results. Regulatory landscapes are evolving quickly. Florida recently passed legislation that allows stem cell research under physician supervision, which opens new avenues for the use of our therapy. We're continuing studies using a basket protocol approach. Why this matters for vascular surgeons? Well, your patients are asking you about cell therapy. Understanding the difference between autologous and allogeneic approaches is significant. So if you're thinking about your no-option patients right now, the ones who have exhausted bypass and stent, you're not alone. That's exactly why our research exists. At Hemostemix, we're studying how the body's repair mechanisms restore blood flow where conventional approaches have failed. Our team speaks with surgeons each week to discuss studies and how our data might inform future care. Too many patients are told there's nothing more we can do. If you're facing circulation issues or worried about amputation, do not wait until it's too late to understand the patient's options. Please click below to speak with our team and learn what our research is uncovering about improving blood flow.